You wake up in the middle of the night and reach for your partner, but your body doesn't respond the way it used to. It's frustrating, maybe even a little disheartening. And you wonder, is this just part of aging, or is there something I can actually do about it? I'm Dr. James Ellison, a board-certified urologist and men's health specialist with over 30 years of experience helping men, fathers, veterans, grandfathers, reclaim not only their physical performance, but their confidence, dignity, and emotional connection with their partners. Most men over 60 assume that erection problems mean they need more pills. But what if the real solution was something simpler, drug-free, and already sitting in your nightstand drawer? I'm talking about a small, medical-grade silicone ring that can help you stay firmer, longer, safely, and naturally. Sounds too simple to work, right? In this video, I'll walk you through 6 essential facts every older man should know about penis rings. How they work, who they're safe for, and whether they could help you restore stronger, longer-lasting erections, without pills, without surgery, and without shame. And at the end, I'll share the story of one of my real-life patients, a 67-year-old man who thought his love life was behind him, until he discovered how to use this one simple tool the right way. Don't miss it. Don't miss. If this topic resonates with you, go ahead and click the subscribe button and tap the notification bell so you don't miss more practical, real advice tailored for men like you. And if this message speaks to you, type yes in the comments. It helps me know what matters most to you. If not, type no. Your feedback helps me serve you better. Let's start with the question that's probably on your mind. What exactly is a penis ring? You may have heard of it, maybe even seen one online or at the pharmacy, but is it really something that can help you? As a doctor, I want to break it down clearly without the awkwardness. Here's what you need to know. 1. What is a penis ring really? I want to talk to you about something that most men don't feel comfortable bringing up. Not with their spouse, not with their friends, and certainly not at the doctor's office. But here's the truth. Intimacy doesn't become less important as we age. If anything, it becomes more meaningful. And yet, for many men past 60, something quietly shifts. You still feel the desire, the love, the closeness, but your body doesn't always respond the way it used to. One of my patients, let's call him Ellison, came to see me after months of silent frustration. He'd been married 42 years. He loved his wife deeply, but his erections weren't what they used to be. Pills gave him headaches, injections scared him, and surgery felt too extreme. He said to me, "Doc, I just want to feel like a man again, even if just for a little while. Is there anything simple that works?" That's when I introduced him to something he had never considered. A penis ring. Not a gimmick, not a toy, but a medically backed tool designed to help support erections in a safe, natural way. So what exactly is a penis ring? It's a small device, usually made of soft silicone or rubber, that you wear at the base of the penis. Think of it like a supportive band. You don't wear it all day. You don't wear it under clothes. You use it only when you're aroused or expecting intimacy, and only for short periods of time. The goal is simple, to help you maintain the erection you already have. Many men find that as they age, they can still get an erection, but keeping it is the problem. A penis ring works by gently applying pressure at the base of the penis to hold blood in the area, making the erection firmer and longer lasting.
Now, I want to be absolutely clear. This isn't about turning back the clock or pretending you're 25 again. This is about reclaiming control, reclaiming confidence, reclaiming a sense of self that may have slowly eroded over time. I've seen it firsthand. Men who feel discouraged and defeated suddenly rediscover joy, connection, and even playfulness in their relationships, all because they dared to try something new. You might be thinking, that sounds too simple. Can something that basically really make a difference? Let me tell you, I've treated thousands of men over my career, and while the ring isn't right for everyone, for many, It's been the first step toward rebuilding a sex life that's both satisfying and stress-free. It's discreet, it's affordable, and it's something you control. No prescriptions, no waiting, just a straightforward tool that puts some of the power back in your hands. And no, it's not embarrassing. Using a penis ring doesn't mean you're broken. It means you care about your health, your relationship, your well-being. It means you're willing to act. But how does this little ring actually work? What's happening inside your body that makes it so effective, especially for older men? That's where the real magic lies, and I'll explain it next. Stick with me, because understanding the science might change how you see not just this ring, but your entire approach to better lasting intimacy. If you're still here and this information is resonating with you, go ahead and type yes in the comments to let me know you're still with me. Now let's move forward and take a closer look at the second key point. 2. How does it work? The science behind the ring. Now that you understand what a penis ring is, let's talk about how it actually works. Not just in theory, but inside your body, in the places that matter when it comes to intimacy and confidence. I want you to picture something with me for a moment. Imagine you're in your 30s again. You feel desire, you get aroused, and everything works like clockwork. Blood flows freely into the penis, fills it quickly, and stays there, firm, steady, reliable. That's because your blood vessels, both the arteries and the veins, are working in perfect balance. The arteries bring blood in. The veins hold it there until the moment passes. But as we age, and this is natural, not a failure, that balance starts to shift. The arteries become less efficient, often due to things like high blood pressure, diabetes, or even years of smoking. But more importantly, the veins lose their tone. They don't trap the blood the way they used to. So even when you do get aroused, the blood leaks out too soon. The result, you lose your erection before you're ready. In medical terms, we call this venous leak. And let me be clear, it's one of the most common causes of erectile difficulties in men over 60. I see it almost every day in my clinic. The good news is that it's also one of the most manageable if you know what to do. This is where the penis ring comes in. When worn correctly, snug but not tight, it gently compresses the base of the penis. Not the whole thing, just enough pressure where the veins are located. That compression acts like a stopper. It slows down the blood leaving the penis, helping to keep it fuller and firmer for longer. It doesn't create the erection. That part still comes from arousal and stimulation, but it does help hold on to the erection, giving you more time, more control, and more confidence. I remember a patient named George, 71 years old, widowed for a few years, finally in a new relationship. He told me, "I get excited, Doc. I really do, but it just fades away too fast. She says it's okay, but I feel ashamed." When I explained the science behind venous leak, his eyes lit up. Not because he understood all the terms, but because he realized it wasn't his fault. It wasn't in his head. It wasn't weakness. It was physiology, and it had a solution. We tried a penis ring along with a simple vacuum device to help him get started. A few weeks later, he came back with tears in his eyes. Not just because the device worked, but because for the first time in years, he felt like a man again. Capable, connected, whole. That's the power of understanding what's happening inside your body. Knowledge removes shame. It replaces frustration with action. And most importantly, it opens doors. You may have thought we're closed forever. You see, the penis ring doesn't treat the underlying condition, but it manages it. Just like reading glasses help your vision or a cane helps your balance, this little ring supports what your body still can do. And for many men, that's more than enough to restore joy in the bedroom and peace of mind outside of it. Now that you know how it works and why it matters, the next question is just as important. Is a penis ring right for you? Believe it or not, it's not a one-size-fits-all solution. There are real reasons some men should use it and real risks for others. Knowing where you fall on that spectrum could be the key to using this tool safely and successfully. Let's talk about that next. 3. Who should and shouldn't use a penis ring? Not every man walks the same path, and not every solution fits every situation. That's something I've learned after decades in medicine. And when it comes to penis rings, the most important thing isn't just how they work. It's who they're truly meant for. Because when used properly, they can restore confidence and closeness, but used carelessly or by the wrong person, they can cause more harm than help. So, let me start by telling you about Frank, a retired teacher, 68 years old, who came to my office after trying prescription ED pills. They gave him terrible side effects: headaches, flushed skin, and a racing heart. He was embarrassed, not only because the pills didn't help much, but because he thought maybe he'd reached the end of the road, that his sex life, like his career, was over. But it wasn't. Frank was actually an ideal candidate for a penis ring. He could still get an erection, just not for very long. He didn't have any nerve damage or major circulation issues, and he wasn't on any medications that raised red flags. For men like him who experience mild to moderate erectile dysfunction, especially due to venous leak, a penis ring can be a simple, drug-free way to maintain firmness during intimacy. I also recommend penis rings to men who struggle with performance anxiety, not because they can't get aroused, but because they lose confidence midway. That stress creates a feedback loop. Worry leads to loss of erection, and the loss reinforces the worry. A ring offers a kind of physical reassurance like training wheels for the mind. Once they see that they can stay firm, often the anxiety begins to fade. And let's not forget those who simply want to enhance sensation or intimacy. Maybe you don't have erectile dysfunction, but you'd like a firmer erection or want to prolong your experience. Some men tell me it helps them feel more in control, more alive. And at this stage of life, that's a beautiful thing. But I wouldn't be doing my job if I didn't tell you who should not use a penis ring. Or at least, not without serious caution. If you have reduced sensation in your groin area, for example, due to diabetes or nerve issues, you may not notice discomfort or damage while wearing the ring, and that's dangerous. One of the most common mistakes I see is men leaving the ring on for too long because they simply couldn't feel the warning signs. If you're on blood thinners, the risk of bruising or bleeding increases. Even a small amount of pressure can cause internal damage if your blood doesn't clot properly. Always speak with your doctor first. If you've ever had priapism, a condition where the penis stays erect for hours without relief, you should steer clear. The added pressure of a ring can trigger another episode, which could require emergency care or lead to permanent damage. And finally, if you have memory issues or tend to fall asleep easily after intimacy, especially if you're using alcohol or other substances, a ring may not be safe. It must be removed within 30 minutes to prevent tissue injury. Forgetting it's there can have serious consequences. I know this may sound like a lot, but here's the truth. The penis ring isn't a magic fix. It's a tool. And like any tool, it works best when it's used with care, intention, and knowledge. So if you're considering it, be honest with yourself. Are you the kind of man who takes his health seriously? Who's willing to learn, to follow instructions, and to treat this tool with respect? If so, this could be one of the most empowering choices you make. But even if you're the perfect candidate, there are safety rules that apply to everyone. Rules that can mean the difference between a helpful experience and a trip to the ER. These aren't scare tactics. They're simple, smart guidelines that every man should know before using a ring. And in the next section, I'm going to walk you through exactly what those rules are and how to protect yourself while getting the most out of this powerful little device. If you're still watching and finding this helpful, type the number 1 in the comments to let me know you're here and engaged. Let's keep moving forward now with point number 4. 4. Safety. First, what every man needs to know. I've spent my career helping men live fuller, healthier lives. But if there's one truth I've learned over the years, it's this. No tool, no matter how promising, is worth using unless it's used safely. And when it comes to penis rings, that principle couldn't be more important. I've seen firsthand how something designed to restore confidence can turn into a serious medical emergency simply because someone didn't know the rules or thought they didn't apply to them. I'll never forget a man who came into the emergency room during my residency. He was in his late 60s and had used a makeshift ring he cut from a plastic soda bottle. He didn't mean to hurt himself. He was just trying to be creative, maybe even save a little money. But he left that ring on too long, and by the time he came in, his penis was so swollen we had to call the fire department to remove it. He was in pain, humiliated, and terrified he'd done permanent damage. That memory has stayed with me, and it's one reason I always speak plainly about safety. Let me be clear. If you're going to use a penis ring, it must be one that's designed specifically for the body. No hardware store items, no bottle caps, no rubber bands. These are not safe. Medical-grade penis rings are made from soft, body-safe materials like silicone or elastomer. They're designed to apply the right amount of pressure without cutting off circulation entirely. When you use a ring that was built for this purpose, you drastically reduce your risk of injury. Another rule that cannot be ignored: do not wear a penis ring for more than 30 minutes at a time. I understand the temptation. You may be caught up in the moment, or you may not notice the time slipping by. But extended use can lead to bruising, numbness, nerve damage, or worse. A lack of blood flow that causes permanent harm to the tissue. If you ever feel pain, tingling, or your penis starts to turn pale or blue, remove the ring immediately. Those are signs your body is warning you something's wrong. And speaking of comfort, always use water-based lubricant when putting on or removing a ring. This makes the process smoother and safer. But remember, if you're using a silicone ring, avoid silicone-based lubricants. They can degrade the material and cause it to break down over time. Stick to high-quality water-based options. And if things start to feel dry or sticky, simply reapply. Another important point, especially for older men: never fall asleep wearing the ring. You might think you'll remember to take it off, but after intimacy, when your body is relaxed, or if you've had a drink or two, it's surprisingly easy to forget. Set a timer on your phone if you need to make removal part of your post-intimacy routine. I've had patients who damaged nerves or developed serious swelling simply because they drifted off and left the ring on overnight. And please don't be afraid to ask for help if you need it. Whether it's your doctor, your partner, or even an instructional video from a reliable source, learning to use the ring properly is worth the time. There's no shame in asking questions. In fact, it's one of the most responsible things you can do. I want you to enjoy your intimacy. I want you to feel strong, capable, and close to the one you love. But I also want you to be careful because used correctly, a penis ring can be a gift. A tool that restores your connection and boosts your confidence. Used carelessly, it can lead to avoidable regret. But safety is only half the story. You might be wondering, what are the real benefits of using a ring? Beyond the science and the caution, does it truly make a difference in how I feel, how I perform, how I connect? In the next section, I'll share exactly why so many men find this simple tool to be life-changing and how it might just be the key to unlocking a more satisfying, empowered version of yourself. Stay with me because this is where the transformation really begins. 5. Why some men love it. The real advantages. There's a moment I cherish in my clinic. When a man, usually in his late 60s or 70s, comes back after trying something he had serious doubts about. He walks in a little straighter. His eyes hold a different kind of confidence. And when he sits down, he doesn't start with complaints or questions. He starts with a quiet smile. That's when I know it worked. Not just the product, but the feeling, the hope, the return of something he thought was gone for good. This is often the experience with penis rings. For many men, they offer more than a physical change. They deliver something deeper, a shift in mindset, a sense of control, a restored connection with their partner and with themselves. And while these devices are small and simple, the impact can be deeply meaningful. One of the biggest advantages is that penis rings are completely non-invasive. There's no surgery, no needles, no complicated medical interventions. For men who feel unsure about taking medication, especially those who've had bad reactions to ED pills or are managing other health conditions, the ring can feel like a safer, gentler way forward. You're not altering your body, you're simply giving it support where it needs it. They're also drug-free, which matters a great deal for older adults already balancing blood pressure meds, diabetes treatment, or blood thinners. Many of my patients don't want to add another pill to the list or deal with side effects like headaches, nasal congestion, or dizziness. With a penis ring, there's nothing chemical entering your system. It's a physical solution to a physical challenge. Another powerful benefit is that penis rings are often affordable and accessible. While medications can cost hundreds over time, a quality ring may be less than $50, and some men only need to buy it once. There's no insurance battle, no pharmacy delays. You buy it, you learn how to use it, and you're in control. Some of the newer rings even offer smart features like tracking erection firmness or duration. I've had patients use these tools to monitor their progress and bring that data to our appointments. It opens up a whole new layer of conversation around sexual health. Not just it's working or it's not, but measurable insight into what's changing and improving. But more than any of that, what I hear most often is this: it made me feel like myself again. There's a dignity that comes with knowing you can still show up for your partner, not just physically, but emotionally. Being able to take initiative, to feel pleasure, to connect, and to be present in a moment without anxiety or interruption. That's what this is really about. I remember one couple married over 40 years who came in together. The husband was embarrassed to talk, but his wife held his hand and said, "We just want to be close again." After trying a penis ring for the first time, he told me it wasn't just the sex. It was lying there afterward, not worrying if I disappointed her. I felt proud again. That's a powerful thing, not because the ring did all the work, but because it gave him the opportunity to engage fully without fear or frustration. You don't need to be in a relationship to benefit either. Many older men use penis rings for solo intimacy. It's a way to stay connected to your body, to keep the blood flowing, and to maintain a sense of agency over your own experience. But as much as I celebrate the positives, I'd be remiss not to talk about the other side. Because while penis rings offer a lot of promise, they're not perfect. In fact, some men find them uncomfortable, frustrating, or even discouraging, especially if they don't choose the right type or size. Before you rush to buy one, there are some common downsides you deserve to know about. And coming up next, I'll walk you through what those are and how to avoid the most frequent mistakes men make when using them. This could save you time, money, and some unnecessary pain. So stay with me. 6. The downsides. What to watch out for. Whenever I recommend a new treatment or tool to my patients, I make it a point to be honest. Not just about what works, but about what might go wrong. Because let's face it, nothing in life, especially when it comes to our health, is all upside. Penis rings are no exception. While many men have found them to be life-changing, there are real downsides you need to consider before deciding if this path is right for you. The first issue that often comes up is discomfort. If a ring is too tight, and many men make this mistake when starting out, it can cause pain, numbness, or coldness in the penis. That's your body's way of saying, ease up. But in the moment, especially when you're feeling pressure to perform, it can be easy to ignore those warning signs. Some men tough it out, thinking that more pressure means better results. It doesn't. The goal isn't to cut off circulation, it's to support it. Too much compression can lead to bruising, nerve irritation, or in worst cases, tissue damage. Another challenge is sizing. Not every penis ring is adjustable, and for first-time users, finding the right size can be frustrating. I've had patients who bought a product online only to find it either slipped off Midas or felt like a vice grip. That initial disappointment can shake a man's confidence and lead him to believe the whole idea isn't worth it. But often it's not the concept that failed, it's the fit. Rings come in different diameters, tension levels, and designs, and what works for one man won't work for another. Trial and error is part of the process, but I always tell my patients not to give up too soon. Some men also report changes in ejaculation. Because the ring creates pressure around the base of the penis, it can sometimes delay or partially block ejaculation. For certain men, especially those struggling with early climax, this can be a benefit. But for others, especially if you're trying to conceive or if ejaculation plays a big role in your satisfaction, it can feel strange or incomplete. It's not harmful, but it can catch you off guard if you're not expecting it. There's also the issue of spontaneity. Let's be honest, sometimes in the heat of the moment, stopping to grab a ring, apply lubricant, and position it properly can feel mechanical. Intimacy is emotional, fluid, and often unplanned. Introducing a device into that moment requires a little more intention, and for some men, that interrupts the magic. For others, especially those in long-term relationships, it becomes part of the routine, something both partners understand and even appreciate. But it's important to know going in that it might take some getting used to. And finally, there's the emotional side. Some men feel embarrassed by the idea of needing a device during sex. They see it as a symbol of failure or weakness. I've had men say to me, "Doc, I feel like I should be able to do this on my own." And I get it. But here's what I always remind them. Using a tool to support your health doesn't make you weak. It makes you smart. You wear glasses when your eyes need help. You use a cane when your knees give out. This is no different. But that mental shift takes time. And for some, it's a bigger hurdle than the physical act of using the ring. That's why I believe so strongly in education, in walking with men through not just the how, but the why and the what if. Because the more you understand your options, the more empowered your decisions become. Penis rings can be incredibly effective, but only when used properly with realistic expectations and a clear understanding of the risks. Still, even after hearing the downsides, many men feel a renewed sense of hope. Not because the ring is perfect, but because it represents possibility. The possibility that life and intimacy can still feel good. That pleasure is still within reach. That age doesn't have to mean giving up. It just means learning how to do things a little differently. So now that we've explored both the benefits and the risks, the science and the safety, you might be wondering, what does success actually look like? How does this play out in real life with real people? In the final part of this video, I'll share a powerful story of one man's journey and what it taught me about courage, intimacy, and second chances. You won't want to miss it. Conclusion: is a penis ring the secret to stronger, longer-lasting erections? So, after everything we've covered, the what, the how, the who, the risks, the rewards, the question still stands. Is a penis ring really the secret to stronger, longer-lasting erections? The honest answer is it can be, but it depends on the man using it. I've sat across from thousands of men over the years. Men of all backgrounds, incomes, personalities. Some walked in feeling broken, others just quietly frustrated. What they all had in common was a desire to reclaim something deeply personal. Their ability to feel, to connect, to express themselves with confidence and closeness. And in many of those cases, something as simple as a well-fitted penis ring became part of that journey back. We started this conversation by talking about what a penis ring is, a small body-safe device worn at the base of the penis to help maintain firmness. We talked about how it works using gentle pressure to slow the blood from leaving the penis too soon. For men with venous leak or milder forms of erectile dysfunction, this one change in circulation can make a huge difference in sexual performance. We also looked at who might benefit most: men who still achieve erections but can't sustain them, men who want to boost sensation, or those facing performance anxiety. At the same time, I was clear about who should be cautious. Men with nerve issues, those on blood thinners, or anyone who has trouble remembering to remove the ring in time.